challenge or as a shortage of infrastructure. So with support from World Vision, the OPD block that was standing next to was actually raised with the support from World Vision. And as you are aware, that for health service delivery to be more effective and more efficient, you actually need the infrastructure. So 10 years ago, this block was standing next to was actually raised by World Vision together with the community.
They did a very fantastic job, as we can now see. And after that, the OPD was commissioned on the 25th of May 2010 by Honorable Musa Echweru, who was the MP of Amuria and the minister by then. After that, the OPD started work, and World Vision continued to support the OPD with many things, like the tables, the benches, and the cupboards. They even could raise some drugs for
the benches, the tables that our patients and health workers use. They actually procure the high quality furniture that 10 years down the road we're still having those furniture bearing the name of World Vision. So I think it is something so good that when they're doing their activities and procuring some of those equipment and infrastructures, they actually went for things that are long-lasting. In terms of community interventions, I already mentioned earlier about nutrition assessment, where VHTs were trained, and then the child protection. You know, children are vulnerable. We are living now in a global world where children get exposed as young as they are. So with the support from World Vision, the child protection unit, both at the sub-county and the entire district, okay, committees were set to make sure children are looked at, the issues of child neglect, the issues of child abuse, the issues of defilement. All stakeholders, both at the grassroots level, from the level of the LOC, the VHT, the LOC3, the sub-county chiefs, the health workers, they are all brought together as a team to ensure that we work towards achieving a safe environment.
Has taught us that we should growth monitoring the communities to know the status of children. Those who are malnourished and we can know from the weight and even the mark can what and give us the right what, the right kilograms and the right thing to do. So now when I was trained by Wellington all that time long, I was been practicing it for many years since World Vision exists in Kamuda here up now. So as you can see now, I have the experience of coming even here to the health center to work to weigh children and mark them. As now I've done, right now from the weighing scale. Teach a child 5 years, then I work on it. I put it that clothes there you can see. That clothes is very good for children below 5 years. Children cannot stand in the weighing scale, so they are weight. So I put a child on that thing, then I put it up there, like that. You can see it's very clear. What? You also need to know this mark tape here. This one is very important because you roll it like this and then you read. From here you can read. For my child there was 16 green, which means the child was doing good. The nutrition status is good. But now when you roll it again like this and the arrow shows yellow, which means it's winning. It's not good. You need what? To improve. And now when you roll it again and read, from here it reads 9 red, which means that child is in danger. So that's why we are happy today, because we can even now know how our children are doing, how they are doing good or they are doing bad. Through this experience I've gone through and through all the things I've been trained with World Vision all those years, I thank them for their
vision for the support rendered to the people of Kamuda in regards to health intervention. World Vision has supported us and established clean water.
17 about sanitation. First.
And thirdly, we are able to access safe water in the community, and we have managed to do disease prevention. And lastly, we have done improved hand washing, improved hand washing at the facility. Those are the achievements we have got from World Vision, and we're encouraging them to